we talk about being homeless, what does it mean?
Well, it's a really good question, and homelessness is as broad as it is long, and it's across the UK. No job, no income, no rent, no home, no address, no bank details, no identification, you're invisible. So for those who are addicts or have substance misuse, this can shorten their life.
What barriers do homeless people face within the healthcare system and access to hospice care as well? Welcome to the Life and Loss podcast, where we break down barriers surrounding discussions of life-limiting illness and palliative care. I'm Hannah, and today I'm joined by Sarah, a Community Specialist Palliative Care nurse. In this episode, we will explore the unique challenges involved in providing palliative care to homeless individuals with a life-limiting condition. We'll discuss managing pain relief alongside addiction, combating prejudice, and ensuring access to essential hospice services. Welcome, Sarah.
Hi, thank you for having me.
So we often have preconceptions of what we think homelessness is, but when we talk about being homeless, what does it mean?
Well, it's a really good question, and homelessness is as broad as it is long, and it's across the UK. There are three categories of homelessness. There are the rough sleepers, who you see on the streets, and they are probably the most visible and hold the most stigma of those out of the three categories. The second are those who are the hidden individuals, and these are those who would be your friends who are sofa surfing or paying for a B&B or dropping into a hostel. These aren't visible, and they have no address and no residence, so these are classed as the hidden vulnerable. And the third is the statutory homeless, and these are individuals who have been recognised as being homeless. They are on the local authority list awaiting temporary accommodation. They're registered with hostels, so they have some details recorded, and they're classed as a priority to be rehoused within that local area, but sometimes it would also be out of area as well.
And how easy is it for someone to become homeless?
It's a lot easier than what people think. So if you think it like this: no job, no income, no rent, no home, no address, no bank details, no identification, you're invisible. So it is very easy, and the challenges are that people think it's often a choice, but often it isn't a choice. And it's very hard to hear stories about how people become homeless, and how with homelessness they become addicts or they have some type of healthcare condition. I recently had a gentleman who was a recovering drug addict. He had his own home and had got employment through a local church and was doing some community missionary work with the homeless out within the Poole area. And he'd started to develop some discomfort within his head and neck region. He'd gone to the GP, who gave him some basic pain relief management and support. But as time progressed, it got worse. He went to the GP, and the GP refused to give him any more pain relief at that time because of his background of addiction. The gentleman presented in the accident and emergency department and explained that he had increasing pain, he was unwell, and unfortunately he was turned away. They said that he had to follow what the GP would recommend. And obviously we understand GPs are stretched and they have long waiting lists. So this gentleman went to the old area of where he lived when he was homeless and where he could get access to drugs. And he started taking drugs again because he knew he needed stronger pain relief, and that was the only way he could get it.
And what happened to him after that?
So he relapsed and went back into full-time addiction, and he presented at the hospital seeking help for his addiction, and the team at that time that saw him offered help on the proviso he stopped all his pain relief for his then diagnosed cancer. So he was diagnosed with head and neck cancer, and he didn't want to stop his pain relief because it was the pain that caused him to go back on the drugs in the first place. And because he refused to come off the pain relief the GP had prescribed him, they turned him away. And then we got a referral to us from the GP surgery asking for help with management for pain. And managing pain with addiction is quite complex and quite tricky.
What prejudice and stigma still exists in the healthcare system and in the broader community?
So in 2021, the Hidden Homeless Charity conducted a survey throughout different areas to find out what those who are on the streets are dealing with in their day-to-day lives. And 73% of the clients that they discussed and had interviews with identified that they had been physically assaulted on the streets throughout their time there, no matter how long they'd been on the streets. And over 53% said they'd had some verbal abuse thrown towards them. And unfortunately, stigma holds no boundaries. It doesn't matter on gender, age, race. They are not seen as a person, they are just seen as homeless.
I hope that you're finding this episode useful. Perhaps you have a question you'd like to ask. You can do this by commenting below. Your input shapes the conversations we have and the topics that we explore. So don't hesitate to reach out and let us know what you'd like to hear more of. And what complex needs can those that are homeless have alongside a life-limiting condition that they may have as well?
So those who are homeless will often have multiple comorbidities, and this is often known as trimorbidity, and they can have anything from underlying health issues such as chronic illnesses, COPD, emphysema. They could have liver and renal problems that could stem from addictions such as alcoholism and drug abuse, heart failure, cancer. Those who are homeless have a shorter life expectancy. So within the England and Wales area, the general age for death for a woman is 46. In Scotland, it's 43. And for a male in England and Wales, it's 48. And in Scotland, it's 39.
Is that for homeless males and females?
Yes. So the life expectancy is much shorter. And what people don't realise, and what those who are homeless don't realise, is sometimes the prognosis is shorter because of their life choices. But it's not as simple as just a life choice. So for those who are addicts or have substance misuse, this can shorten their life. But because they're homeless, they don't have access to resources such as Alcoholics Anonymous, access to the GP for nicotine addiction and things like that. So if they had the availability for those resources, you might find that the life expectancy is exceeded.
So is there a way to manage addiction and pain relief for a condition simultaneously?
So managing the two together, as I've said, is very complex, but it can be done. But it requires specialist knowledge and understanding of both aspects of pain and addiction, but also understanding the complex issue of being homeless. So what we would always say is that the two have to be separate and they have to be met individually. So if someone presents with a cancer, we will use certain medication to address and treat the cancer pain and the breakthrough pain. And then they predominantly usually already on something for the addiction, such as methadone. And that is usually managed by the drug addiction team within the hospital and community setting. And what we do to ensure that there is no overlay with prescribing, we ensure that there is a sole prescriber. So that will usually be the GP. That would be the sole prescriber for that individual.
What barriers do homeless people face within the healthcare system and access to hospice care as well? So
barriers can be varied for each individual and each local authority. Some of the barriers seen within the community are the fact that they haven't got a GP. Contrary to belief, they don't have to have a registered GP. This is not in the NHS England guidelines, but some GPs are not aware of that. So they feel that they can't give advice and support to a patient if they're not registered with them or have an abode. So it's trying to push through that. Also, healthcare professionals within all different settings have very limited experience with those who are homeless, unless that's their speciality, like the homelessness team. So they often don't know what is required of them. They may have some experience but are lacking in knowledge and don't know who to turn to. Often those who are homeless have multiple comorbidities, so they're not sure which issue needs to be addressed first. And again, age. And as a clientele, the homelessness have barriers themselves with attending appointments. They often feel that they don't get the support they need. They feel that the hospital environment is quite restricting. They're looked down on. They feel uncomfortable in the environment they're in, so they don't attend appointments.
So it becomes a vicious cycle almost.
Yes.
How important then is collaboration to help those in need?
Collaboration is the key. Collaboration and communication will help identify those in need. It will help identify knowledge that is needed for the healthcare professionals to be able to engage with those individuals and provide the support that is needed. And by doing so, it brings more awareness of the homelessness situation, what they face globally, and how we can help address that. So as well as the health bus, which is available in Bournemouth, within Poole area, I've been working closely with the local charity Roots to Roots. I've also been working very closely with the hospital palliative care team and the liver team that cover Royal Bournemouth Hospital and Poole Hospital. And I also attend the high intensity service users meeting, which is monthly, which looks at every patient that comes through ED as a high service user, so they are repeat attenders, and we look at why they are attending, and by doing that helps me identify if there is somebody homeless that may have some specialist palliative care needs as well.
So in your opinion then, if you had a magic wand and could improve things, what needs to be done in palliative care to those who are homeless?
It would be nice to be able to have some more local resources. In Bournemouth they have the health bus, which those who are homeless can access, and my colleague from the Macmillan unit, Lisa Mahoney, has worked closely with them and has seen the benefits of being able to have that. It depends on the local authorities and funding and knowledge, and I think the more it's publicised and the more it's put into the public domain, then more awareness is there.
Yeah. Thank you so much, Sarah. And thank you for listening to the Life and Loss podcast. If you'd like more information on our work, you can visit our website, which is forestholmehospice.org.uk. Thank you. If you found this episode useful, click the subscribe button. Share this episode with a friend or loved one. And don't forget to give us a like and share your thoughts in the comments. Your support means so much.